Happy and Healthy, a series to help you learn about available resources.
Hi, I'm Patty Suarez, Vice President of Marketing and Communications for the West Central Florida Area Agency on Aging. Welcome to Happy and Healthy, a program designed to provide resources for seniors, older adults, and their families. Today's discussion, we're going to focus on understanding your healthcare options. And our third guest is Genevieve Faulk. Genevieve is a licensed clinical social worker, owner of Aging Care Advocates, and she's a certified care manager. Thank you all for being here with us today. Well, this sounds like a perfect entree into Genevieve and what she does as a geriatric care manager. I mean, this is where you come in and your expertise comes to play. Tell us about geriatric care management and what you do.
Well, it's interesting, Patty, because I've been in the field of geriatrics for 16 years, and I found that it's really easy to explain what a social worker does, but it's not as easy to get people to understand what a geriatric care manager does. So I've kind of narrowed it down to a couple key points. The first is geriatric care managers serve as like a guide, or a guide dog, so to speak, that helps someone navigate the difficult healthcare system, where when they don't know which way to turn and they're stuck in a situation with a loved one where they're at the hospital and the discharge planner saying, go look at these facilities, and they have to decide, what are we going to do with mom? What's the next step? They're overwhelmed. And that's what a care manager can do. A geriatric care manager can help guide that family through the difficult healthcare system.
Now, is this something people should do before the crisis happens, or that would be ideal, right?
Well, like Candy said with regards to long-term care insurance, I think it's really important to plan ahead. Plan ahead with what your wishes are with regards to your health care. Plan ahead with regards to who's going to advocate for you should you need help down the road and you're not able to make medical decisions for yourself. Plan ahead to know what communities, what facilities, what home care companies you want to use, if and when you need to use them.
Yeah. Now, when a family comes to you and says, we need help, what's a typical scenario you may encounter?
I think I have two really good examples. The first one is a group of children that have their mother at home who has dementia, and they've just realized that mom has started really declining at home. And there's 5 children trying to help support mom, rally around mom, get her the types of services in place that she needs, but mom is resistant. And mom says, oh no, I'm fine. I don't have any problems. I don't have a memory issue. You've got the memory issue. You've got the problem, not me. And so the children really struggle with that respect for their mother and trying to, it's a balance, it's a fine line between respect and trying to properly care and make sure that their mom is safe. So what we do is we step in with the family, we support them, we guide them through the process of talking with their mom or their senior parent or family member through that whole process of taking those steps to get their loved one what they really need at home or into some type of setting that will support them. And we do that usually by getting involved ourselves as the care manager and building a rapport with the senior and the family and taking baby steps with them along the way, because it is a difficult situation. And when people are faced with it, they're overwhelmed. The senior's overwhelmed, the family's overwhelmed.
Right. So
So we're there really to help them. We're there to be the calm in the storm, to give them a peace of mind.
almost like a mediator, it sounds like.
Right.
Yeah, exactly. And do you find that families might be resistant at first, but then become more receptive? I mean, do you typically have
There's situations, and I was going to tell you another example, which was we have oftentimes multiple children that maybe half the children agreed with the care plan for mom, and the others, usually they're out of state and not nearby, are not in agreement. So what we do as a care manager is we sit down with the whole family. Sometimes it has to be via a phone consultation or a phone conference with the whole family and really facilitate family discussion about what's best for mom, what's best in her interest, and how can we all get on the same page and really work as a team together and not really be at each other's throats about this, but join forces and work together.
Yeah, and it sounds like that's a very valuable service. I would imagine, what does geriatric care management services cost?
It really depends upon where you are, but really in this area it ranges anywhere from $70 an hour to about $100 an hour.
Okay.
And it's really important when you're looking for someone, if you do, to look for someone who is a certified geriatric care manager. That means that they not only met a certain educational level, but that they've been through training and they've also taken an exam to make sure that they know what they're doing.
Right. Genevieve, I'm sure you deal with families who mom or dad, for instance, is at home and doing fine for a while,
Right.
but you know, the family may do this knee-jerk reaction where, you know, we have to get mom or dad into a facility. But it sounds like there are stages that you can go through before you make that decision. Do you help families work with that decision?
Right, right. You know, a lot of times we have family members that are at home and they're doing, they have their senior loved one at home and the family member is either overseeing them themselves or they hire us to get involved and oversee them because they're long distance. And we help manage the home care that's in place, all the different resources that might be in place, from an emergency button that's set up to Meals on Wheels to different services that might come in, like Medicare home care. We really oversee the individual, the senior at home, to make sure that they have all the needs possibly met to keep them safe at home. And then there might come a point where they're progressing in the disease process, whether it be dementia or a different disease, where they're really needing more help. And it's something that is manageable at home, but it's getting more and more difficult, and their finances are starting to get a little strained. So then we help work with the family and the senior in getting them placed in the most appropriate setting, not just the one down the street, because that might not be the best scenario for them. They might need a different type of setting that's really appropriate, that meets their specific individual needs, which is really important.
And it sounds like the relationship with the geriatric care manager is a pretty intimate relationship. And I would imagine if I were in that situation, I'd want to pick the right person, the right care manager for my mom, for instance. How does somebody go about deciding that?
Well, I think that it's very important to look for someone that is certified, someone that's a member of the National Association of Professional Geriatric Care Managers, and that can easily be found by going to their website, which is www.caremanager.org.
Okay.
There is a list of questions that you can ask a care manager and that you should ask a care manager on their website. To be sure that you're getting someone that you can trust is going to not only know what they're doing, but do the right job for your loved one.
But should you interview them as well? Like
Absolutely.
From a personality perspective, maybe?
Absolutely, and that's a very good point, because there are certain care managers that are wonderful and they're credentialed, licensed, but they may not be the right fit for your mom,
Right.
for you, and for walking the family through different steps. So I think it's very important to interview, to ask for other clients that they've maybe worked with before, if they could speak to the family members and get a reference check. I think that's really important to do. And those are all things that everyone should go through and focus on when they're hiring a care manager, is really looking for the right fit. So that was a very good point.
Welcome back to Happy and Healthy. I'm Patty Suarez, your host for today, and we're talking about understanding your healthcare choices. We've had some conversations about different options regarding how to manage that, and we're going to get a little bit more into some dollars and cents issues in this half of the program. Genevieve, I'd like to come back to you. As a geriatric care manager, you deal with folks day in and day out. You talked a little bit earlier about rates for geriatric care management being anywhere from $70 to $100 an hour, and some people may gasp and say, wow, that sounds like a lot of money.
Yeah.
Can you tell us how that really ultimately can maybe save people money by using the kind of service you provide?
Right, and that won't be the first time I've heard that, the gasp. But I will tell you that I think that people will find it well worth it if they spend even an hour with us. They will get a wealth of information in that hour.
So they don't have to hire you for a long-term contract, for instance?
No, they can hire us for an assessment, which looks at the whole picture of what's going on with the senior, every aspect. They can hire us for ongoing services to oversight, manage, and advocate, or they can hire us as a consult or a consultant to be involved just for an hour.
So what do you mean by as an advocate? What do you mean when you say that?
What I mean by that is that oftentimes family members will hire us to go in and oversee seniors in facility settings, whether it be assisted nursing home or hospital settings. What we do is we go in and we review the charts, we talk with the staff, and we make sure that things aren't falling through the cracks, because things can fall through the cracks, as we all know. No one's perfect. And so we serve as that advocate for the patient or for the senior, and we provide a peace of mind to that family who's either here local or long distance that things are going okay.
I can imagine. I know my dad was hospitalized several years ago for about a month, and me being in Florida and him being in New Jersey, it was very stressful trying to figure out what was going on with him and why he was getting moved around and things like that. And you know, I can see how he certainly could have benefited from somebody who has that expertise going in there. And so I can see how that can certainly pay for itself. And it's good to know, I guess, for folks to know that they can hire someone on a short-term basis just for some upfront advice and then come back to you periodically. And so are you kind of on call? Do you show up at the emergency room, for instance?
Thank you so much for saying that. Yes, we are on call 24/7.
Okay.
So we are always available to our clients and their families, because emergencies just don't happen 9 to 5. They happen all the time. So we're there when they need them, and that gives families and seniors a tremendous peace of mind knowing that we'll be there when they need them.
Yeah, absolutely. Genevieve, do you encounter people, we had this conversation in my family, my brother, my sister, and I were talking with my mom, and we said, if anything ever happened where you couldn't, you know, take care of yourself, would you rather have help in the home or would you rather go into a facility? And my mother said, oh, I'll go into a nursing home. And we were like, oh. Well, she said, because I wouldn't want to burden you. And, you know, it was such a sweet thought, but we said, well, what would you really want? She goes, well, that's not what I want. But do you find that sometimes that promise, we decided we weren't going to promise my mother, we'll never put you in a nursing home, because we felt like we might not be able to uphold that promise. It may get to a point where we couldn't take care of her at home, but we would do everything we could to keep her at home. Do you find people make those kind of promises to their loved ones and then, you know, have a hard time dealing with the fact that they maybe made a bad choice?
We find that a lot, and I really try to encourage everyone, please don't make those promises, because you don't know what the future has in store. You don't know if your mom's going to have a situation where you can't physically care for her at home, and she needs to go into some type of community setting, like a nursing home. So I always encourage that, and you know, I also find the opposite, where seniors, like you said before with your mother, didn't want to burden the family. They didn't want to spend their money, so they were staying at home trying to make it on their own because they didn't want to save their money because they wanted to save it for their kids. So I see that as well. So we really try, part of our job really is helping families and seniors working through all of those thought patterns from the past or guilt issues and try to help them work through it and past it so that they can truly get what they need at that moment.
Okay, great. And Genevieve, sounds like you're the kind of person who could help facilitate that kind of a conversation, right?
Definitely.
What would you closing words be here, some words of wisdom?
I would agree with what Candy just said. Plan ahead. Don't wait until it's too late. Caregivers know when to ask for help. Family members know when to ask for help. Don't wait till it's too late, because at that point you may not be able to help your loved one anymore because you don't have the energy to do it. So just plan ahead. Educate yourselves, go to as many seminars, get as much information that you can gather, and seniors, know who you want to advocate for you and put that in writing in a directive so that that is there when you need it.
You know, I think one of the things we brought up that's really true is we're all kind of in denial that we're going to age, we're going to get sick, we're going to die someday, and it is a difficult conversation to have. It is awkward. Do you have any way you typically, you know, start people off?
Well, I think it has to be done. And that's just it. You cannot put it off, because if you put it off, that crisis might occur and then it's too late. You need to have those tough conversations while mom and dad are healthy to have them, and have their mind about them where they can express to you how they truly feel.
And it can be a gradual conversation.
Right, absolutely.
Right. Well, thank you all for joining us today for this edition of Happy and Healthy. I'm Patty Suarez, and I hope you have a great rest of the day. Thanks for joining us.